Hi everyone, Dinesh Sirisan here, and today we're going to be talking about imaging the cervical nerve roots. When imaging the cervical nerve roots, I tend to have the patient either seated upright, with the head flexed in the opposite direction of the side you want to investigate, or I have them lying down, again with the head flexed in a sideways position so that it exposes the side that you want to image. When undertaking the imaging, I tend to use a linear transducer. That's because this allows me to see a wider area, and also it allows me to evaluate other structures, including the vasculature as well as the nerve root as it exits from the cervical spine. And here's a diagram of what you will expect to see. The first landmark that you come across is the C7, and you use this as your landmark because it has a posterior but it doesn't have an anterior process. Once you've identified the C7 vertebrae, then you move proximally and you see the C6, and this has a both anterior and posterior process, and then the C5, C4 and so forth. And here's an example of the image that you will see. So for the C7 vertebrae and C7 nerve root, there is a posterior process but not an anterior. On the next image, you can see for the C6 vertebrae and nerve root, there is an anterior and posterior process. It's important in both situations to turn on the power Doppler to evaluate the position of the vertebral arteries. Thanks for watching. I hope you found the video informative and it adds to your knowledge of musculoskeletal ultrasound imaging. If you did, please remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter and Instagram. And please remember to check out sportsmedinfo.sg. Thanks again, and I hope to see you all very soon.